start with some basic movements to stabilize the lower back. Some of these things are going to be similar to what we did for the sacroiliac joint, but this is for the lumbar spine area into the sacroiliac joint, so we'll be focusing a little bit higher. One of the most important things is to find neutral spine, and for most people, working solely in a neutral or optimal spine is critical to help alleviate the pain and stabilize that area. All right? So I'm going to walk you through how to find that for yourself. But again, like I said, it's very individual. So what you're really looking for is no pain and then stabilizing in that area. So if you are seated and you're arching your back forward, this is going to be an excessive lumbar lordosis. And people who have this oftentimes will have weak abdominals, and their hip flexors, or the muscles that bring their legs to their torso and torso to their legs, are overly strong, and the abdominal muscles are overly weak. All right? Someone who has a flat back, so that would be this way, oftentimes will have overly strong hamstrings or short hamstrings, and then the lower back muscles are overstretched and often very weak. So we're going to try and find an area between that, and we're going to call it neutral or optimal. All right? Really, we're just trying to find that spot where everything is lined up with a curve that feels good for your body. So let's lie down and see if we can figure out where that might be for you. So, one of the easiest things to look at is from the front, and if you can find, there are two little bones that you can dig into. And those are your hip bones, one right by the other. And they're the anterior superior iliac spine is the fancy name. And then the other bone we can line up is our pubic symphysis, so that's our pubic bone. And you can make a little triangle, so you can put your hands in a triangle and place it on top. Ideally, that's pretty parallel to the floor. So if you can put the heels of your hands on the two hip bones and the fingertips towards the pubic bone, if it's the pubic bone or the fingertips are tipped up, that would be a flat back. Or if you have an excessive lordosis, the fingertips will be below the heels of the hand, and you can try to line it up that way. When you're in the neutral spine, you will have a little space, and you can put your hand underneath your lower back for the most part. It won't be a big space, but you will be able to at least gently reach your hand under your lower back. And what you can think of is pulling your back up and your belly down. So those 2 points come together to support you. So when you're working, ideally, particularly if you have lower back issues, you want to stabilize that area and do most of your exercises with your lower back held in this position to help stabilize the area. The next thing that we want to think about is breathing, okay? So breathing helps to fire up our transversus abdominis, and that is that muscle that wraps around from the back of our spine all the way to the front of our spine. And what we're going to do is inhale through our nose and then exhale through the mouth. And you'll exhale if you have like a pinwheel, like a kid's toy, like a little pinwheel, or even just a piece of paper. You should get the pinwheel to go or the paper to move. That's one easy way to see if you're doing it properly. And you'd be surprised at the number of people who can't do that, all right? Because their transversus abdominis is so weak that they can't get the air out through the deep stabilizers, and it just sits in their lungs. That's not good for your lungs either, but that's a whole other conversation. Okay, so we're going to take 10 breaths In our neutral or optimal spine, with our belly to our back and our back to our belly, inhaling through the nose and exhaling through the mouth. And every time you exhale, I want you to think about pulling the belly to the back and the back to the belly right in the middle to create that corset of support right in the lower back where you may be sensing some pain. All right? So we're not pressing our lower back down. Our lower back will be lifted a little bit while we do this. So go ahead, lie back down, and take the heels of the hands towards those hip bones and the fingertips towards the pubic bone. Make sure you have a little arch in your lower back. So you don't want the lower back pressed down, but you also don't want it to be too big of an arch. Right in the middle, and you shouldn't have any pain right now. Take a big inhale through your nose, and now exhale. Belly to the back and back to the belly. Let's do this 10 times together. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Belly to the back, back to the belly. Again, inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. One more. Inhale and exhale. Fantastic. Turn side. Try and stay in neutral while you turn side. And then bring yourself up to seated. So that's another thing that you need to think about when you're transitioning from onto your back to back seated. You want to make sure that you're doing it in a way that you're not putting pressure on your lower back and just ruining all the stability that you brought there. So turn side and then press yourself up without being in a very contorted spinal position to help support that lower back. So this simple exercise of breathing in a neutral spine is a very wonderful tool to start stabilizing those deep stabilizers in your spine and to help alleviating some of that pain that you might be feeling there. All right, let's practice getting down without hurting ourselves. So we're going to sit in neutral, and then you're going to carefully bring yourself onto your side in neutral. And now you're going to roll to your back and try and maintain your neutral that we just discovered. You should be able to figure out a way to get up and down without pain, all right? So you want to try to position yourself in that neutral spine that you can turn side and come up and down without hurting yourself. The next thing we're going to do are our hip lifts. Now this is just probably one of the best exercises that you can do if you don't have pain while you're doing it. If you start doing it and you have some pain, stop, like with anything else, all right? Something's not aligned or something isn't strong enough for you to be able to tolerate it. So we're going to line our toes straight forward. You're going to feel the balls of the big toes down, knees straight to the sky, and you've got your neutral spine that we just talked about, whatever was good for you, okay? I'm going to have you put one hand down by your pubic bone, the other hand up at your rib cage. these 2 points want to remain equidistant. So as you come up, you don't want them to come together. That would mean you flattened out your lower back, and we do not want to do that. Remember, we want to fire up all of our lower back muscles. So this exercise is going to fire up your abdominal wall, your transversus abdominis to help support your lower back, your lumbar multifidi, and your hamstrings, and it's also going to stretch out your hip flexors in case you overuse them. All right, so here we go. We're going to take a big inhale. Now as you exhale, think belly to the back, back to the belly, and then you're going to press into your feet and lift your hips straight to the sky. Inhale, and now exhale. Stick your tail out and try and keep your hands equidistant. Now if you cramped, I'm guessing some of you did, just shake it out a little bit. All right, it's very common. Make sure you have plenty of magnesium, sodium, potassium, and water in your system. But sometimes also if our muscles just aren't used to doing this much work, they'll cramp, so just rest out of it. Let's do 9 more. Inhale, big breath out, lift, press into those feet. Make sure, double check, did your knees just knock together? Oh heavens, open them back out. Did they just splay apart? I hope not. Bring them back forward. Keep the balls of the big toes down. Take your breath. And now exhale. Stick your tush out and reach it to the ground, keeping your hands equidistant. Inhale. And here we go. Exhale. Lift. Inhale. Exhale. Control the lower. So don't just drop down there. I want you to control it. Inhale. Exhale, lift. Inhale. Exhale, lower. Make sure you're exhaling just before you move, because that is going to help you fire up your abdominal muscles so that you stabilize your back. If you wait till after you move to exhale, then you're not going to have that deep support and it might hurt. All right, let's go again. Inhale. Exhale first, then move. Inhale. Exhale first, then lower. 5 more, my friends. Inhale. Exhale. Then move. Inhale. Exhale. Lower. 4 more. Inhale. Exhale. Inhale. Exhale. Lower. 3 more, please. Inhale. Exhale. Inhale. Exhale. 2 more. Inhale. Exhale. Inhale. Exhale. Last time. Inhale. Exhale. Inhale. Exhale. Good. All right, keep your neutral spine. You can relax your arms, but I want you to turn side in your neutral the best you can. This is your practice. And now you're going to push yourself up to seated. All right, again, trying to maintain that neutral so you have that support and stability in your lower back. And I want to reiterate, it is so important. This is one of the things that I see. People will do exercises that are supposed to be helping them stabilize themselves, and they're not breathing. They're not supporting themselves with their breath. And it's crucial that you start to retrain your transversus abdominis to fire just prior to movement. And this is how you start, okay? You exhale, then you move. And in the beginning, you may need to make a very clear distinction, all right? And if you've been giving a list of exercises that you're supposed to already be doing to help stabilize your lower back, I encourage you to start doing it with this breath pattern. The results are just much more effective and quicker when you work this way, rather than doing a whole bunch of exercises but not incorporating this very crucial breath element to strengthening that lower back.